Hello beautiful people, welcome back to my channel, Mind Your Mental Matters. I am Yvette and in this video, I will be talking about bipolar. We always hear people talking about bipolar this, mood swings that. So in this video, I want to get down to what exactly bipolar is, what are the causes, what are the symptoms, and the treatment for this mental illness. But before we get into that, let's clear the air a bit and talk about what bipolar is not. You know, people usually throw this bipolar term around whenever somebody is moody. We all have that friend maybe who can just be really happy 1 minute and then get really pissed off when we piss them off, they can just go from laughing with you to screaming at you in a short span of time. And that's when you hear people saying, yo, azange angihlafune kanje umuntu just because I was 2 minutes late. Hayi phela loyo ne-bipolar kabi nje loyo. Or you hear somebody saying, my friend got really mad at me when I was late for lunch. She's so bipolar. Okay, Ibambe, no. Okay, people are allowed to get mad at you or pissed at you whenever you piss them off. Okay, that is not indicative of what a bipolar disorder is. Okay, right. Now that we know what bipolar is not, what is it then? So, bipolar, or formerly known as manic depression or manic depressive disorder, is a mental health condition that causes extreme mood swings that include emotional highs, known as mania or hypomania, and emotional lows, such as depression. So these mood swings can affect your sleep, your behavior, and just your ability to think clearly. People with bipolar disorder may have trouble managing everyday life tasks at school, at work, or just maintaining relationships. In the relationship, we just know that relationships are not easy. We all know that no marriage or long-term relationship is easy, right? For example, in South Africa, where I'm from, about 4 out of 10 marriages fail before their 10th anniversary. In Canada and in the United States, 40% of all marriages fail. So that alone just shows you, relationships can be really tough, guys, But the statistics for marriages involving a person who has bipolar disorder are just especially alarming, really. There's an estimated 90% of these relationships or marriages that end in divorce. That's just from an article I read about managing bipolar disorder, and there could be many reasons for this. Maybe the person with bipolar doesn't understand what they're suffering from, or their partner doesn't understand what the hell bipolar is, or maybe this person who has bipolar is just not getting the treatment they need. Sometimes spouses feel like they've done everything to help the person who's suffering by bipolar, but their efforts have just gone in vain. So these could just be some of the contributing factors. But whatever the reasons are, guys, like bipolar disorder does make it harder for people to maintain relationships, especially when they don't know what the problem is. So let me give you an example. I have this friend, right, who has bipolar. And before we knew that she's got bipolar, she would always talk about her relationship with her fiance. So she would always post things on social media, on her Facebook, Instagram, whatever, about how beautiful and how great her relationship is. Oh, my fiance is amazing. He did this for me. Oh, my fiance, look at our relationship. Oh, couple goals, this and this. She would be constantly on social media posting these things about her fiance, even telling us about it, how the same girl is coming to us now in a totally different setting, in a totally different mood, where she would just be so depressed and be like, oh, this guy, I hate him, he's just horrible, he's a bad guy. He doesn't do this for me, or he's done this to me, and she would be really, really depressed, How? Sisahleli lapho with depression, oh no, this guy is horrible. There she goes again. Oh, things are amazing between me and this guy. Oh, he's the best bae in the world. Couple goals, look what he's done for me. That sort of vibe, you know. Now, from a distance, when you're looking at this, it could look as if this person is pretending to be happy, or she's just a fake person. Because 1 minute she's all happy and da 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 da, and then the next she's like, oh, right? Now, when we then later found out, we would see, no, this person is actually suffering from bipolar disorder. It actually made sense when I started to get into what exactly bipolar disorder is. You know, what are the symptoms and what really goes on to somebody who's got bipolar. I actually realized, you could see, when she was having those moments of happiness and, you know, feeling so pessimistic and so positive about her relationship, she wasn't being fake. That's exactly what she was feeling at the time. And that's the mania side of bipolar. That's the euphoria side of bipolar. She was really, really feeling that kind of happiness, right? And then when she would come back and say, oh, but this relationship, oh, this is what it's doing to me, oh, this guy's like this, that's when it was now on the depression side of things. You know, that's when that's the depression side of the bipolar. So even in those moments when she was feeling down, those feelings were validated, because that's exactly what she was going through, because that's exactly what happens when a person has bipolar. That's why it's very important for us to be able to distinguish between regular mood swings and bipolar, right? It said that depressions caused by bipolar disorder can last for about 2 weeks. Unlike somebody who's just woken up on the wrong side of bed and then just that one day they're just feeling down, right? Or a high manic episode can last for several days or weeks, which is very different from somebody who just is very jolly one day because they woke up on the right side of the bed. That's the difference, yeah? Some people will experience episodes of changes in mood several times in a year, while others may experience them just very rarely. It's different from person to person, but some of the symptoms that we can look out for include the 3 main symptoms actually that occur with bipolar: mania, hypomania, and depression. While experiencing mania, for example, a person with bipolar may feel an emotional high. They can feel abnormally upbeat and jumpy, very impulsive, increased energy, and increased activity, or just increased agitation, where they're just so irritable, exaggerated sense of well-being, or an exaggerated sense of self-confidence. You know, they're just overly confident, or they could have racing thoughts, distractibility, decreased need for sleep, or just unusual talkativeness when they just go on and on and on and on and they just keep talking. During these manic episodes, they may also engage in behaviors that are really irresponsible or make poor decisions, you know, and start to engage in things like maybe spending sprees or unprotected sex or drug use, or just make foolish investments. You know, for hypomania, the symptoms are very similar to mania, but they're not as severe as mania. So unlike mania, hypomania will not result in any trouble at work or at school or in social relationships. But people experiencing hypomania still notice changes in their mood. Then when it comes to depression, if somebody's having an episode of depression, a person may feel or experience deep sadness, hopelessness, loss of energy, loss of interest in hobbies or activities they once enjoyed, insomnia or too much sleep, suicide thoughts. You know, these are some of the things that they may experience. But I did a separate video on depression that goes into more detail, so I encourage you guys to check that out. That's going to be very helpful. But bipolar disorder, though, is not a rare condition, but it may be very hard to diagnose because of its varied symptoms. Yeah, the main symptoms of bipolar disorder may be different between men, women, children, and teenagers. For example, in many cases, women with a bipolar disorder may be diagnosed later in life, maybe around their 20s and 30s. They may have milder episodes of mania. They may experience more depressive episodes than manic episodes. They may have maybe 4 or more episodes of mania in a year, which is called rapid cycling. Or they may experience other conditions while they are struggling with bipolar disorder. Some things like thyroid disease or obesity, anxiety disorders, or just have migraines. Women with the bipolar disorder may also relapse more often, and this is believed to be caused by hormonal changes that are related to menstruation or pregnancy or menopause. So if you're a woman and you think that you may have a bipolar disorder, please get the facts right and please get help. Okay? Men, on the other hand, so men and women often experience the same kind of symptoms, but men experience them differently. What I mean is, men with the bipolar disorder may be diagnosed earlier in life. They may experience severe episodes, especially manic episodes. They may have substance abuse issues. Men with bipolar are less likely than women to seek medical help on their own, and as a result, they are more likely to commit suicide. So if you're a man watching this and you think you may have bipolar disorder, you are not weak. Please seek help. Okay, I'll do a separate video on the symptoms of bipolar in children and teenagers, so do look out for that one. But now that we have defined bipolar disorder, let's see how these symptoms relate to the different types of bipolar disorders. So we have bipolar I, bipolar II, and cyclothymia. For bipolar I, it's usually characterized by mania or mixed episodes. So this is the classic form of the illness, and it is characterized by at least one manic episode or mixed episode. Usually, but not always, bipolar I disorder also involves at least one episode of depression. Then we go to bipolar II. Bipolar II disorder is usually characterized by hypomania and depression. So in bipolar II, you don't experience full manic episodes. Instead, the illness involves episodes of hypomania and severe depression. So people with this type of bipolar disorder would experience one major depressive disorder that lasts at least 2 weeks, and at least one hypomanic episode that can last for around 4 days or so. And if you go to cyclothymia, it's characterized by hypomania and mild depression. So this is the milder form of the bipolar disorders, and it consists of cyclical mood swings, but the symptoms are less severe than full-blown mania or depression. If you discuss your diagnosis with the doctor will be able to tell you which bipolar disorder you have, and they'll also be able to tell you that even though bipolar disorder is a common mental health illness, it's not quite clear what causes it. The possible causes could include genetics, your brain. Your brain structure may just impact your risk for the disease. Or it could be environmental factors such as extreme stress, traumatic experiences, and physical illnesses. There is no cure for bipolar disorder, but there are several treatments available. And the most effective treatment strategies for bipolar disorders would include a combination of medications, counseling, lifestyle changes, and social support. I'll always also encourage helping yourself. Self-help can include things like educating yourself and those around you. Get moving. Exercise has really beneficial impacts on mood. Okay, keep stress in check, meditate, pray, seek support from people around you, make healthy choices, watch what you eat, monitor your mood, and keep track of your symptoms, so that you can notice what gets your moods really swinging. If you spot the symptoms in yourself or somebody else, please don't wait. Ignoring the problem won't make it go away. I hate to say this, but you cannot pray it away either. It's like if your hair starts falling because of cancer. You cannot pray the cancer away, yeah? But you can pray to get the right doctor. You can pray to get the right kind of treatment. You can pray to have the right kind of attitude that will help you and get you through the symptoms and get you the help that you need, right? Living with untreated bipolar disorders can lead to problems in everything, from your career to your relationships to your health. So just think about this and get the help that you need. If you're reluctant to seek help because you like the way you feel when you in a manic mood, I mean, it's nice, you feel happy, you are overly confident, you've got all this joy, you're shopping, you like this feeling. So why should you get help for it? Well, you should get help for it, because remember, when you're manic, that energy and euphoria, they come with a price, guys. Mania and euphoria usually turn into a destructive behavior. They tend to be destructive and they end up hurting you and the people around you. So early diagnosis and treatment can really just avoid these kind of complications, okay? So please get help. There is absolutely no shame in you getting help. There is absolutely no shame in you having bipolar disorder, okay? So I will leave this one right here. Thank you guys so much for watching this video. Let me know if it was helpful in the comment section down below. Let me know if you've learned something. Let me know if you found this very informative. Do share your thoughts with me, share your stories with me, and let's get the conversation going. Please do share this video with everybody that you care about. It's going to help somebody out there. If it's gonna help you, it's gonna help somebody else. So please do share the video, and please don't forget to subscribe to this channel. Remember, I'm sharing this with you guys based on what I know, what I have learned, and what I have researched. But if you are looking for professional help, please seek professional help from a professional. And until the next time, thanks once again for watching. Lots of love, lots of light, and perfect mental health to you and your people.